Now, one of the sort of end procedure or salvage procedure could be patellectomy in case of the recurrent subluxation. Usually, it's nowadays not done, and as the indication of patellectomy are actually decreasing day by day, and partial patellectomy or complete patellectomy is rarely done nowadays. And the reason is that actually it disturbs the tracking of the patella, and the whole mechanism of the cord function is actually disturbed. But in certain research articles, for example, if the recurrent dislocation is not settling down with all the ligamentous procedures or bony procedures as well, and now it has actually produced end stage arthritis, then we can go for a very drastic procedure such as patellectomy. In form of, it could be partial patellectomy, or a complete patellectomy can always be done as well. But that is sort of an end result kind of a procedure. If nothing can be done, then we can probably go for this sort of a procedure. But now, on the whole, the indications for patellectomy are actually decreasing day by day, and it's actually rarely done in the case of recurrent patellar dislocation as well. But if the recurrent dislocation or subluxation is not settling down, we have done the reconstructive ligamentous procedures, but it's failed, or it's still the recurrent dislocation is happening, then we may have to stage the treatment to some form of bony procedure, which could be in form of a bony realignment, suprapatellar and infrapatellar, or it could be in form of a bony osteotomy such as Elmsall, Trilard, or Fulkerson. If that also fails, or for some reason the tibial tubercle goes into non-union, then we may have to go for this sort of a procedure, because eventually the arthritic changes which have developed in the knee joint, especially over the medial femoral condyle, that could be more problematic for the patient, and we may have to go for some form of a drastic procedure in form of partial or complete patellectomy. But as I told you, usually patellectomy is rarely done, and if done, it's usually done with chondroplasty as well. Therefore, patellectomy without chondroplasty is also a disaster and should not be done, and patellectomy should be reserved for those chronic cases in which no other option actually has been exercised, and we are practically left with no option but to go for patellectomy.